as you mentioned before, you came with a shoulder injury,
Yes.
right? It's 1 month old. You started feeling that pain.
Yeah.
1 month ago.
Mhm.
Doing a specific movement. You remember what happened?
Yeah, from playing paddle.
Mm-hmm.
So it's the movement when it's up. It's the tendon.
Mm-hmm.
So I've been to a normal physio and they confirmed I had just a deep tissue massage,
Mm-hmm.
and they can feel the tendon that it's just.
All right. Is there a movement that causes pain right now?
If I go up and back. So
Okay. Can you try it now for us?
yeah.
Okay. How much?
There's the pain.
How much pain do you have from 0 to 10? 10 is maximum pain. How much would you say in this moment right now?
The more I move, it can get worse. 6, 7.
6, 7.
Yep.
Okay.
It's like a sharp pain.
Sharp pain on a specific location, right?
Yeah, on the muscle.
Mm-hmm. All right. So I know that you have heard about ANF therapy.
Mm-hmm.
But if you have more questions, we are happy to answer.
Okay.
What we are going to do now is a clinical examination of the shoulder joint and anything else that is needed, because we need to find the root cause of your problem, why you develop this active inflammation and why you have pain today. So for that, we are going to bring Dr. Mikel, and he will be here to help you with that.
All right, Pam, nice to see you. Yeah. Oh, yes, I need this again.
May I take my t-shirt off to be able to?
Yeah.
Yep.
So,
well, this is connected.
Yeah,
Yeah.
fine.
but you can take the t-shirt off because I need to check. So here we have another injury. This is a very good paddle player, by the way. And we know the shoulder is very, very complex. And because the complexity of the shoulder, we also know it's very much rush among many to diagnose it. They don't really know what it is because it's so hard to get into it. It could be compensation injury. You can find, as I said, a tendon. It can also be an neurological. It can be a bursa. It can be many, many things in the shoulder, especially when they say you have pain of upper rotation backwards. It can actually also be coming from the neck. So we need to check everything. But of course, first, we always check where the patient complains and see what it is and see how bad the pain is. And when you learn here during our medical education to examine after the nerve system, you will never be doubt when you find the source, because as you saw the former patient, the pain is quite massive. So we will check his shoulder also. Of course, important to look after everything that could look abnormal when you look at the shoulder, that the body can tell you anything on the structure of the muscles back and forwards. And because I know this guy is also playing a lot in high level, so therefore he put a lot of pressure on his arm when he's playing. So we're going to start, as always, we check all the tendons. So we start with the biceps. And you just tell me if it hurts too much. Right? So we go in here. So I can feel already here now, and you can feel this too. The tendons is quite on fire. They are very swollen. That means they're under quite much pressure. So we go in between here. You can see I go in between the muscles up to clavicula and try the bursa, and now comes the pain. Because when he raised the arm like this, he impinged the bursa and put pressure on the clavicle, on the whole joint. That creates pressure on the ligament and the tendons. So we continue to check this here. In between here, here we have the clavicle, and we go right in here. And this is a tough, strong guy, and this is no pressure. But he feels pressure.
How much pain would you say?
Yes, 8 or 9.
Yeah. So
close to making me
scream.
Yeah.
So, but this is also why many athletes on high level come here to find the source, because it can be so many symptoms around the shoulder. So I'm going to continue here. So I'm going to go and check his pecs also here. And here's also a little bit structure damage.
I can feel the pain's less, but I can definitely feel it's there as well.
If I go deeper.
Yeah.
So everything here is located here. So you can never, ever just check one thing on the shoulder. You need to check everything. This is so complex, and all the main nerves comes from the cervical spine, out to the arm, from to the chest, and everything this needs to work as a unit. So we need to find all his injuries here to make sure that the pressure from this goes away. When you get this kind of bursitis inflammation, another thing can be to put pressure on top, but that doesn't give him much trouble.
No.
So we continue. So here, up bursa, we hook the biceps tendons and pull them like this. Now we can see his pecs is swallowed up a little bit. So we find something here for sure. So I go into the pec tendons here, under them, here, and pull. But that's okay. Check everything detailed here. Behind here. Go also supera. And back. This feels fine. We go to the infraspinatus. I just follow the structure here. I'm over the moon now. That's his tattoo.
Oh yeah, the brain sign.
So we're checking here too. We go up to the shelf here where we have the tendons from the triceps. This feels fine. It's no damage in the structure here at all. So he's probably lucky. We go here on the front. You want to come here? Yeah, checking out the moon. So because of this injury here, and you can see here when he rotates the arm, that very strong here, swollen, it's a lot of pressure, contraction here, weakness here, and that means, of course, that it's very hard to train this part that is weak.
Yeah, because this might be important as well. If for example, I do a bit of gym work, the thing that causes the most pain is a bench press, which is for your chest.
Yeah.
But the bench press, when I come down and then push up, I can get a shot. If I do too much weight, I can do a sharp pain goes.
Yeah. So when you hold
it, chest.
Yes, and you hold the arm like this again, so you can see here, this should be firm, same structure when you do like this. And then here, so this is very strong, weakness. So he put a lot of pressure on, could be technique-wise if you do bench press, that creating this. But this here, I will check his arm. Just hook the tendon here. And this is just to check everything. Okay, so we're gonna fix him up. This is definitely bursitis ligament injury together with pecs. And when you do like, it feels here, you can feel this, eh? It feels like structure damage, eh?
Yeah,
crunching, yeah. So we're gonna release the pressure here. We're gonna remove active inflammation here. We're gonna see the difference.